And I'm delighted to say that for this third in our webinar series on urban responses, we have Ted Tuthill from British Red Cross. Ted is the Recovery Operations Manager for BRC, working in the disaster management team. He's to oversee the implementation of all international recovery programs, both bilaterally, because of course the Red Cross does a lot of work with Red Cross and Crescent national societies, and also multilaterally in partnership with FRC and the ICRC. Got a strong urgency and recovery program implementation background. Has worked with International Medical Corps through the Middle East, and also with DFID's Chase Operations team. At the moment, Ted's working alongside the BRC's Humanitarian Policy team, examine the challenges of working in urban context and identify best practice to ensure effective program implementation. One of the reasons that I'm so happy that Ted and BRC are able to present today is that we've been looking over this series at how humanitarian action, ideas of humanitarian action, both if you like a theoretical and a practical level, have really been challenged by urging operations in urban contexts. And I think what Ted is going to be able to give to the group is a real sort of quite in-depth understanding of the particulars, the nuts and bolts of how operations work differently in a very concrete example of the BRC's operations in Port-au-Prince, and also an area which we haven't yet touched on in this series, but which is important, which is we start to understand more about how operations need to be different. We also start to understand that our organizations have changed in order to enable that different way of working. And this is an area that BRC, along with several other ALNAP members, have really been looking at in some depth. I hope Ted is going to be able to also with us the example of what British Cross have done when they take these quite difficult operational challenges and say, so what does BRC have to be like if we're to fulfill on these new ways of working? So with no more ado, looking forward to a fascinating presentation, I'll hand over to Ted.
Hi, good afternoon, everybody, and thank you very much to ALNAP for hosting this event. It's really great to be here and to get the opportunity to, if you like, provide the field-level view of some of the challenges that are being faced in the urban context in the areas in which we operate. As Paul said, I am looking after the recovery operations for the British Red Cross, and our key area of work, or our largest program at the moment, is responding and helping the people of Port-au-Prince recover from the earthquake in 2010. And so I'm gonna look at the challenges we face in Haiti in some detail, but also I just want to tie that in with the higher level piece of work which the British Red Cross is taking on, which is trying to capture the learning and the lessons that we've come across, and pretty much from mistakes we've made and things which we should have done better, to ensure that we build that back into future programming and make sure we get it right next time round. Working with the Humanitarian Policy team over the past year or so, we've done some interesting case studies from Djibouti, Haiti, and also we're looking to do another one in Kathmandu later this year. We've put together a really interesting document which I will plug throughout this presentation, called Learning from the City. The challenge that's been thrown down to me by the Humanitarian Policy team, as Paul was saying, is how do we actually embed this learning in the operations? We too often give lip service to this and do nothing about it. And thinking about this presentation when I was trying to prepare it, I started asking myself, what are the operational challenges we face that are specific to working in urban contexts? And I tried, being a simple generalist that I am, I actually tried to sort of get it down to the nuts and bolts, and to identify what it is that on the ground is really, who's implemented a program, is we face challenges which we can't possibly predict at the beginning of a program. What we set out to do at the beginning was the methodology and the modality in which we try to do programs aren't always the way that we end up, but it's how we adapt, it's how we identify solutions. And working in urban contexts, which are incredibly complex, there is something to be said about the nature in which we go about that problem solving. So, in this, sort of the main part of the presentation, I will sort of refer directly to our recovery program in Haiti, to highlight some of the challenges we've faced. When I mean challenges, I mean problems, and try to sort of articulate how we have addressed those, how we're managing those problems on an ongoing basis, and what we can learn from in the future. I will then just sort of try to line how we institutionally plan to embed this into the British Red Cross, and sort of always, as ever, working alongside our sister national societies and the Federation and the ICRC as well, because I think I don't think anyone's in disagreement that the urban context is going to be the location for the next major disaster, and for the base for location of programming that people in our line of work will be doing over the next for the very foreseeable future. So just to pull out from the document, they're learning from the city, the 5 key areas that we've identified as important and key to working in urban environments. The first around sharpening context analysis and deepening the quality of assessments, which means pretty intuitive and straightforward. Earning cash and markets better. The economy is going to be the focal point and the driver of any community, whether that's rural or urban. Being able to access that and exploit the opportunities that provides will key to ensuring sort of appropriate programs. Otherwise, there's very much a chance that we are not doing programs which are relevant or have any meaning for people, where cash is a main consideration for everything that they do. Next, engaging and communicating with complex communities. This one is I feel quite strongly about having such as Sada City in Baghdad and Gaza City in the Gaza Strip. I'm always struck about, if you like, international organizations' failure to be able to really engage with people on an individual basis, to be able to access the communities that they live in, to understand the factors and the pressures that they're under. I struggle to understand the factors and pressures that my own family deal with, and so to claim that we can go into intensely complicated environments and come up with a solution to problems is a very arrogant standpoint. And to be able to really drill down to the individual needs and address those is a challenge which I think will consume as we go forward. So their understanding how to engage and communicate with them is key. Then adapting to the changes of the land and built environment. Key characteristics of an urban setting is the built environment, and it can't be ignored. Whatever sector you're working in, it will always be a factor. So that's another strong one. As is engaging with local institutions, local authorities. They are the centres of power and they're the levers of change. So to ensure that we don't try to circumvent them, which can be very tempting, especially in sort of post-disaster settings where they are either not functioning or very badly disabled, is key to ensuring a long-term impact and not just a waste of money and a flash in the pan. So that's what the British Red Cross came up with throughout all of their I thought it'd be interesting just to compare it against the work that ALMAP's been doing, to see if we're along the same sort of lines or not. And ALMAP, I think, have got 9 lessons which they come up with, and we've got our 5 ways forward. And what that's a lot of text, but when we narrow it down, I think there's pretty much no daylight between the two areas that come through. The ARM lessons, I think, are slightly more specific in terms of sort of asking to look at specifically how to tailor different sectoral approaches to the urban setting. But I mean they pretty much support each other, and I think that's right. This begs the question, and this question I'll come back to at the end of the presentation as well, and I'll be interesting to hear some of the questions that come through, is are we looking at a new way of thinking? Are we looking at the urban context as a new challenge? Because the activities that are sort of highlighted here in the lessons and the ways forward, me as someone who's operational, I hope that all those things are contained in every program design and implementation, whether that's rural, urban, conflict. So the question is, and which I challenge my team to, especially when we try to look to see how we can embed urban working into programs, is it that we need to make sure that our programs are better in themselves? Do we have the best practice correct? Or are we looking for a new area? I think there might be new technologies, and that will require tailoring to the urban context. But is it just about making sure that we do the basics correctly? And it's something that hopefully we can come back to at the end. So the British Red Cross has been in Haiti since the earthquake, and we've been working there with our partners, the Haitian Red Cross and the Federation. I actually deployed to Haiti as part of the UK Fire Search and Rescue team with the Chase Operations team, the immediate aftermath. And I remember very vividly being struck by that we were in a city, and for those who I know will have been there and have worked in Haiti, those first few days and those first few weeks were characterized by an inability to get around the city. The piles of rubble which were blocking the streets, the traffic jams, which is still a feature today, but at that time were something else. And those discussions at that time as to how to address, trying to make sure that, I think it was about 2.5 million people had access to basic services. And in those first few weeks, about making sure that they had shelter for the upcoming rainy season. The challenges that working in that urban context were overwhelming. As a city, I think is a typical urban setting, incredibly dense, creaking infrastructure, creaking local authorities, of extreme poverty. So it's a very interesting context. The British Red Cross responded multilaterally with the Federation in the first stages, and that point has been going through a number of different recovery programs. In the south, there was a cash grant program. We've also been involved with the Federation in decongesting the emergency shelter camps through their integrated neighbourhood approach, responding to the cholera outbreak, and also putting in terms of prevention. And finally, we are working with a community in downtown Port-au-Prince in Dallas 19 to take an integrated urban reconstruction and regeneration program. This program came about from working with a camp called Automeka, where we undertook a participatory approach to self-shelter assessment. It's a bit of a mouthful, but it's called PASA, which identified Delma 19, and that's a picture of Delma on the right, as an area for where most of the inhabitants had come from. And we decided to take it on, and we're in the last year or so of filling off that program. It was for the British Red Cross, and it has required a lot of new thinking. And the team there have really come up with some very innovative solutions and made some very key decisions, which I'll touch on later on, which I think have very much facilitated the success of the program. Following on from that and the assessment, what very quickly became apparent is that we were not able to just focus on one area, one sector to address. Everywhere we looked, whether it was on shelter or livelihoods or water and sanitation, there were linkages and there were overlapping with other areas. So I think it's reasonable to say that work in an urban context automatically means having to address multi-sectoral needs. How you approach that can be very complex, especially in a model where a certain organization might have a specific skill set in a specific area. Nervousness to engage in a sector where that expertise does not exist in-house can be there. But I think that the urban context is, if you like, a very good opportunity and a driver to ensure coordination with different actors. It's almost by necessity. In we are undertaking a livelihoods, a microfinance, and a construction elements, but there are still specific target beneficiaries where we don't have the expertise, and so we have a very useful and successful collaboration with HelpH, who are providing bespoke support to the elderly population, who are among some of the most vulnerable. So from that side, I would say really daunting, and it can sort of increase the size and presence that an organization might have. But in the first stages of planning and design, interconnectedness and the agreements that you're going to require to achieve your narrow aim will have knock-on effects in other sectors, and that can't be avoided when we're in an urban context. Is the interconnected, complex nature of unity. The movement to properly engage with communities, with stakeholders, with different groups with vested interests, has knock-on effects. To ensure that people are properly being consulted, you're almost opening a Pandora's box of the different dependencies that come along. Especially if you try to do it in a responsible, accountable manner. Different groups, the different subsets, all of them have a voice, and to be successful over the long term, to develop that relationship, those voices have to be listened to. They have to be part of the process. Think about a city such as London and the consultation that would go into putting in place a new parking bay, etc. It should be no different. The longevity and success of program interventions have to be built upon the approval of the beneficiaries. The PASA approach is one that was trialed and developed by the British Red Cross team in Haiti. Has been very successful, but the caveats that come with that are that as soon as you go down that path, you have set expectations, not setting them, but the expectations are set. You have said we will consult on all areas of engagement and intervention, and we will come and seek your input and approval. And that's quite a big undertaking. That needs to be taken seriously, because there are financial management and time constraints. It's much harder to implement unilaterally, and it has to be taken on responsibly. The key innovations of our response program, which was innovative for the British Red Cross, maybe not for other organizations, was the creation of a community mobilization team. This was dedicated resource of a team, which I think currently stands at about 18 to 19 people. Whose sole role was to be an interlocutor with the local community. They are the only point of contact between the British Red Cross technical program team and executive team and the community. This has been a really interesting learning curve for us. You found the congested nature of an urban context and the different viewpoints and the different frustrations. What happened and what did happen was we're getting different program staff were getting different feedback, being asked questions on different areas to them. So we spent a lot of time unpicking what had previously been said, or the answers that had previously been given by different members of the team. We obviously had a complaints line set up, but for a lot of people to go that extra effort and to raise that complaint is another step. We had to have presence in the community. Dedicated community mobilizers who are some of the most phenomenal guys, really have a huge amount of energy, and they capture every single piece of feedback that comes from established meetings, from community meetings, but also from walking down the street and from talking to people. And they have an SLA in place, a service level agreement, to provide feedback and a response of some kind. It might not be a clear answer, but a response to every question and query raised. Now this has an overhead, and it requires an awful lot of engagement by the programs teams to be. The mobilizers have grown, seen by both the community and the program team as objective facilitators. They're trusted by the community and are sought out because they know that they will get a response and that they know that they will be engaged with them. So, of just familiarity. If you have someone coming back to you who you know you have the relationship with, this facilitates negotiation. The doubt when we're first looking at this was how would we allow the technical program teams to be able to get across those messages, those technical messages, which they would need to do to be able to get approvals and move forward with their plans. That has very much been outweighed by the skill and negation ability of the mobilizers. They are able to be much better arbiters and push agenda forwards on both sides, from the community and from the program teams, and to succeed in getting an agreed upon output. It's investment for the program, but I think the challenges that it's overcome has been worth it. In a context, we're lucky enough to work with our sister national societies who have extensive volunteer networks, and there's a lot of work doing around beneficiary communications. Unfortunately, in this area of Port-au-Prince, the Haitian Red Cross branch capacity is not that great, and so we're working alongside them with their volunteers. But the community mobilization team, many of whom come from the community, have been able to ensure that we are visible and accountable, and also responsive to the community that we're operating in. Second is around land tenure issues, and all those who have been in Haiti will know of the challenges that brings up. The law, the legal system, and the structure of land law in Haiti is very complex, and is still evolving as we speak. A lot of Port-au-Prince up until about the 80s was a swamp, and large parts of it, including the area where we're working, is effectively reclaimed land. There are an enormous amount of intricacies in terms of how you would register your house to claim ownership for it, and this varies as to whether it's private property, state property, or reclaimed land, and this changes over time. Many people lost their documents during the earthquake. Many people own a house but not land. Many people are squatters. It's a very, very difficult situation to operate in, but in long-term reconstruction, the answer, what we realized is that there is no way around not engaging with the system. It has to be engaged with. If possible, strengthen that done that will have long-term effects. A few very simple things that we're doing in Delma 19, which not seem a lot, but start a chain action, if you like, to ensuring better rights and a safer, sort of a more secure land tenure rights, is just mapping out the lines of people's properties that they see them. Maps don't exist in these dense environments, these these slums where houses will pop up. If you're able to just define the barriers of shelter, this allows you to be in a better place to advocate with local authorities. If there's a map drawn up, this might not have legal standing, but this is a first step a long way to enable people to the system. From that basis, we're also supporting people engaging paperwork and engagement with to apply for ownership of land, and that's just one step along the way to demonstrating ownership. You also have to demonstrate that you pay tax. We mapped down to 19, down to the last house and the last dwelling. Some of them are not even can be classed as houses, and we're currently at the stage of working with the local mayor to help him develop his planning process. The quite rightly taking a long-term view of any reconstruction that happens in the neighbourhood, and actually taking a very sensible 15 to 20-year horizon and trying to understand what will be the impact of any construction going on at this point for the future. So we're trying to push through with planning permission, but when there isn't a process for planning permission, circumvent it. We have to come up with the adequate solution we need to do, and we have to do that together. So it's a very satisfying and fulfilling experience to work alongside the local authorities to help them develop the structures and the processes that they have in place. It's difficult, it takes time, it takes technical expertise, and it takes an approach which would not be a place around trying to build a set of buildings in central London, but that standard at which we should be operating at, and not using a vacuum of law process to proceed without getting it right. with the land, I'm going to skip forward here. With the built environment, suggested areas, access is almost an obvious one to put in there, but it has enormous knock-on effect to day-to-day activities. We undertook to build a canal in Downers 19, and the very fact that we were not able to get concrete or cement to where we were building, about just over 300 meters of canal, was an incredible challenge. A lot of the alleyways, you have to turn sideways to walk, and they're certainly not big enough for a wheelbarrow. So how do you overcome this? How do you get the job done in budget, on time? And this is a challenge you wouldn't necessarily face in a rural context. You'll be able to drive up, dump off your goods. The impact upon the local communities as well. There will be disruption, and this is where community engagement is so important. So that takes time, money, and something that always has to be considered. Link that is the location of your staff. The British Red Cross doesn't have the profile such as the likes of ICRC and maybe MSF in working within the community, which more risk averse, and tend to be sort of co-located with other sort of operation partners. In Haiti, the Federation base camp where we were based was about not more than about 1.5 miles from the program location. But during rush hour, during congested times, getting stuck in traffic, that can knock 40 minutes, an hour off your day each way. This has a knock-on effect when you're trying to get a team of 30 to 50 people up and running. So about 18 months ago, a brave decision was made to move the operation from base camp into the heart of Del 19. This had immediate benefits. We were much more visible to the community. We were much more able to engage with them. But we're also able to be to give some visibility and explain better what we were doing, and it was key to working alongside the community mobilization team. The physical barriers that knocks down has benefits, but there are the risks. Staff are a lot more exposed. You're under a lot more scrutiny, and the city considerations are certainly greater, especially in unpredictable, congested areas, which Delma 19 is, where there's a high prevalence of gang crime and other crime. It's risk, but it's paid off. But then change very, very quickly. We've had, and touch wood, we've had no security incidents. Our main mitigating factor against, or injury or petty crime is the support that is given by the community. They much see themselves as having a vested interest in keeping the British Red Cross offices, staff, and materials safe. And that is to ensure that the security risk is mitigated, but it could change very quickly. With that, and just to skip back, is that working environment has on staff members. It's a really difficult context to work in, any of you will know. But working in such close proximity to fisheries on a daily basis will have increased effects upon the staff operating there, or when there is the expectation of delivery and for that to come through. This is not anything different to other programs. I believe that it exacerbates escalated. But this to be managed from the back end through supportive HR structure, through the right amount of rest, and also bring into that the length of time that's necessary to get programs done, and working around the limits of your staff rather than the limits of timelines and plans that have previously been set, with no regard given to the staff that come through. The key is the area, because they are the ones who are literally on the front line. If something goes wrong, they will feel it, and they have to be supported in doing that. I think finally, on the operational challenges, this is one that has often been fed back to me by the delegation in Haiti, is we don't have to reinvent the wheel when we come to look at different approaches, different toolkits, and things like this. A responsible approach toolkit at the beginning says this must be adapted to the local context. And this is no different really for the urban environment. The tool that I've mentioned was originally set up to be for rural context. And apparently there was a long discussion and heated debate about whether it would be appropriate to use in an urban context. But like most things, it's really about understanding this in which you're engaging with, really doing the thought around that and thinking openly, adapting the toolkit necessarily. There'll obviously be new technologies and innovations, and that can be said for all different contexts. The key, however, is that risks are going to be lower. The risks are going to be greater in urban context. Getting the approaches right and then make sure that they are adapted, not just for urban context, but that specific context in which you're operating in, is key. But I again argue that's applicable to all programs. Before putting it up and operations, the key difference, if you like, around the indie and the risk and the cooking in a urban context over a rural one. I think all the processes and program approaches are similar, and things that need to be taken into consideration in terms of it that can be applied across the board. But it's very much to me similar to how you would view security and in a conflict area over working in a non-conflict area. The worship program, whether it's in Aleppo or within South London, you should always undertake a risk assessment. And the assessment will demonstrate very different requirements and ways of operating and the modalities for implementing programs, but you will still have gone through the process. So I think in urban context, you still have to go through the program process that you should do for every other text, but there has to be an understanding that the level of risk at which you're operating at is a lot higher. The chances for things to go wrong if you don't get those processes correct will have a greater impact. The time, money, and management that it takes to operate there is certainly greater, and it just requires, I believe, better, more active management. That is the key difference between urban and rural working. So to outline how we're going to invest in the British Red Cross, we have the humanitarian policy team cutting and collecting case studies to demonstrate the different areas and ways in which we're working. For my team, the recovery operations team, it's really about ensuring that when we go through our program cycle management, at each step, we are properly evaluating the risks and the impacts of working in urban contexts. And that spans right the way through the life cycle. And most importantly of all is regularly managing the risks and looking right through the organization from top to bottom, the level of risk that is willing to be accepted of working in those environments. And that's not just from security, that's also from financial and from an HR perspective. But they will all have an impact because the intensity is greater of working in an urban context. Finally, it's just to make sure that we are preparing our staff and delegates to work in those contexts. I attended a personal security training a few months ago, and I'm sure many of you have done it. It was quite interesting. The role plays were around coming up to a checkpoint in the middle of nowhere and having to negotiate your way through a checkpoint in some rural location. But it's not operating, likely going to be operating in the vast expanses of East African savannah. But we are going to be operating in the confines of a small cafe in the middle of a slum in Dakar. The set is probably different. The understanding of what it is we're setting out to do and how we prepare those people is likely to be different. So making sure that the training that we have is fit for purpose. It is going to be fit for the locations that we're operating in. And that can be from security management to community engagement. It might no longer be sitting underneath a tree having a cup of tea with a rural community. It might be in an arcade somewhere in a sweaty place in some congested city. These are all things which we have to adapt to and respond to. So that's it for me. I think we're going to go over, and if there are any questions come through. Yeah.
So much, Ted. You've raised many fascinating issues there. I know you didn't come here today to plug your book, so I will instead just to say that it was an excellent and very interesting report by British Red Cross. Learn City is among over 1,000 documents which are available on the Urban portal. So if you want to see it, go to www.urban-response.org and you'll find it there. Got questions coming in. I'm going to go to the first one first, actually. It's a question after my own heart about assessment. Evan from World Vision in Kenya, World Vision, of course, being one of the other agencies which is really pulling with the issues of how to urbanize responses. Ken is asking several questions, the first of which is about assessment. Whether, Ted, you have any specific, sorry, I'll just look at the exact Kevin uses. Specific tools, whether BRC has actually adapted needs assessment tools for use in the urban context. I know that ACAPS is looking at doing something like this, but I understand we don't have anyone from ACAPS here today, but I understand that ACAPS hasn't started, or at least hasn't completed that piece of work yet. But maybe BRC has. Could you tell us a little bit about what you have?
Yeah, no, certainly. I mean, I think the one that sort of immediately springs around is around the PASA. I mean, that's a particular focus around shelter. But I think it comes back again to the fact that there are a lot of assessment tools out there, and it's about how they're adapted for the urban context, rather than maybe looking for specific urban design ones, and that will come through from the nuance of the people on the ground, but just ensuring that adapted appropriately. I think the type of assessment that you're going to do is maybe not context specific but sectoral specific, and so to understand the different sector you're operating in, I think that will be important as well. I'm sure there are specific assessments out there. I'm not too familiar with the ones that are for our context, but I think it's just really about tailoring them to your specific context, whatever that might be.
In fact, Rebecca from IRC is asking a similar question, which is how IRC is currently dealing with the context analysis. That's obviously part of the overall operational analysis at the beginning and ongoing, and how BRC is balancing the need for detail versus time. This is one of those areas which I think a lot of people are looking at, and I'm not sure. I don't know. I'm looking at it. I'm not sure whether there are answers for this yet.
No, I mean, but the question around the level of detail and over the level of time, it is such a changing. Urban contexts are characterized by a changing and transient population that moves through. So it can be very hard to take a snapshot and hold that for any particular amount of time without it becoming out of date. I think it's around community engagement, the assessments in terms of ensuring that text analysis is correct has to come extensive consultation and community engagement right up front. That is a double-edged sword in terms of that gives you widespread engagement with the community, but then there's also that expectation that you have to keep facilitating that and drawing upon that, and that's where the community mobilization team comes in. They're very much the finger on the pulse of what is going on in the community and the changing needs, and that they really have. The feedback that we've received through the community mobilization has direct impacts in the type of activities that we do and the sequence in activities and implementation. And that, if you like, provides you with the ongoing context analysis, that relationship. I think it can be quite artificial to try and hope to get a complete and stable view of the situation on the ground. But it's better to have that dynamic relationship and understanding and be able to respond.
Particularly around the way that the assessment mechanism and the fluidity and dynamism of the assessment mechanism needs to support the fluidity and dynamism of the city itself. And in fact, on the issue of community mobilizers there, Joshua has just put in comment, which how great it is to see the use, BRC or IFRC's use of these community liaison officers, and suggesting also that it might be possible to consider using members of the diaspora in a similar sort of way. This is issue that we're looking at with IFRC in Haiti about the community mobilizing part of the mechanism of feedback, and that on that report on feedback will be coming quite soon. On a slightly different question, Del here is the discussion and agreeing with the contextual issues and the difficulties, but also talking a little bit about the importance of recognizing that there are opportunities that don't exist in rural areas for programming. And perhaps the community mobilizers are an example of that. Are there any other opportunities that the Haiti, the Port-au-Prince context gave the and IFRC? I
think the obvious one is around the markets, the prevalence and the ubiquity of businesses and the many different crossing markets makes you really appreciate the impact that financial support can have and the knock-on benefits that it has throughout the community. It's very hard to have an intervention with one person without there being some knock-on to a different sector of society. And I think a lot of the around with cash and with understanding markets is really, really important because they are themselves a very dynamic beast. And so if you're able to support that, I mean, certainly as a driver of change and as a way of bringing back, strengthening the community, if you're able to support the markets in whatever way that might be, that is a key area. And I mean, markets that can range from massive wholesalers to at the end of the day informal credit between people, which is pretty much how commerce operates within Port-au-Prince on an informal basis in terms of family members, friends lending each other a gold here or there. That formal mechanism was, if you like, the spark for developing a microfinance approach, whereby the British Red Cross has established what they called mutual solidarity groups, whereby groups of like-minded people can come together and put together savings a little bit every month or so, and provide the bank accounts and the mechanisms for doing that, and help them draw up the statutory laws for which that group is governed. And we've really seen that take off, and that not only has an impact in ensuring that people have more access in times of need to savings, but the groups that have developed, there is an automatic increase in resilience. We have a group of people who have a common interest, who are working together, and to an understanding the flows of cash and the impacts that can have, really is, I think, probably never going to be able to understand the dynamics of any community completely, but we have a bit of an appreciation of the role that money plays. And if we're able to understand that and build on that, then we're really able to engage in the heart of the community.
I think Gareth here is asking, Ted, it goes back to another of the points that you made about how is the city different, and is it different? Well, one of the ways it's different is, to put it simply, that it's a city. There's a lot of buildings in it, and a lot of planning is required around those buildings. And so it's very easy to get snarled up, and I think you said that it would be easy to try and avoid some of these urban planning and reconstruction issues, but you just can't. And what Gareth is asking, he's mentioning there's a lot of urban plans being developed by the Haitian government. But many of these, obviously the planning process is quite a slow process, and many of those are only now being completed. So how an operational agency such as yours, and to what degree have you been able to incorporate your work in rehabilitation and rebuilding, where obviously people want things quite quickly, with these planning processes? How has that actually played out on the ground?
Well, I think a lot of people know it's a very, very difficult area, and there are a lot of actors in Haiti are struggling with this, especially around long-term reconstruction. And I think so the likes of Architects for Humanity and Habitat for Humanity have done an awful lot of work around how to improve the land system. There's no easy answer, to be honest. I think there are different options if looking to solve the housing problem, if you like. But I don't think, in terms of long-term reconstruction, there is an easy answer, other than those systems have to be developed and it has to be engaged with. Just to talk about one of those different options is the IFRC has a very effective integrated neighbourhood approach, which is used to great effect to decongest some of the emergency shelter camps. And in that sense, they're not creating new buildings, but they are accessing the flats and the houses that are out there and are able to be rented, and so supporting people in getting back and renting those houses. Just that small push and push forward. And they found, when they've gone back a year later, even though they will have only supported people moving out with enough money to pay for 1 year's rent, that they are very often there sort of 2 years later, and just that that one small help up has allowed them to recover and to be able to start paying their rent in their own way. And so there are other solutions, I think, in Haiti, and there are houses out there to be rented. The urban planning is a real complicated area, and it's linked with trade and large population movements, which the governments are quite rightly taking their time over.
I'm going to give the last question, although it'll be an abbreviated version of the question, to Florent, because I know that Florent is currently working in a lot of these issues on the ground and has much experience coming out of the programs in Port-au-Prince. And so the question that he's asking is, how do you take all of these lessons and these reflections and concretely ensure that they're embedded in the organisation for the future, for the next operation? Now, I'm going to, in the interest of time, and Florent, I hope you'll forgive me, I'm going to just slightly change that question. If you had a magic wand and you could be granted you could wait and get one wish, one thing changed about your organisation that ensured that this learning goes into future programming, what one thing be?
I'm going to be probably not very. I'm going to be very diplomatic here, but I'm going to say that the process, and I think it's a slightly leading question, but I thank Florent for it, is that the process that Florent is going through at the moment, and he's undertaking, I think if it's Florent Del Pinto, he's a federation undertaking a piece of work, really to look and to identify specific areas where learning can be institutionalized. And they've broken that down to a sectoral basis. And with organizations such as the Federation and 187 national societies and the linkages, especially the role it plays in developing new approaches, is to ensure, as I said, things like trainings, existing day-to-day activities, and just ensure that we continue to adjust. As I said, I don't think it's going to be radically new thinking, or there's going to be different approaches. It's going to make sure that in an incremental manner, different parts of the organization are better aware of and better equipped to take in these situations. And Haiti provides an enormous amount of lessons. It's just about mainstreaming those and making sure that they become almost mundane lessons and commonly accepted, as much as doing a risk and security assessment might not have been the norm 30 years ago. Understanding the context in urban in a situation will become the norm, because that's just where we're going to be operating in, and certainly where the next disaster, major one, is going to affect the most amount of people.
So much for that, and thanks for coming in today and sharing your experiences and your organization's experiences with participants who we can see here from the attendee list are phoning in from around the world. For Ahmed, Natalia, JB, Joshua, Rebecca, Louisa, Mark and Kevin, we know that we haven't answered all of the questions that came up, and we're sorry that we don't have time to do that, but I would like to say to everyone, thank you very much for attending, and those questions hopefully can be answered by continuing this conversation in the online forum, and we'll buy Ted a Coke and hope that he'll put some time into maybe putting some answers into those things, and also that everybody else who might have answers to those things will also